All right. In this lecture, I'm going to teach you a very easy way to understand EFT, which is called Emotional Freedom Technique. One of the weirdly powerful techniques used in the therapeutic circles nowadays. And I want to tell you all a little bit of background about it, the principle due to which it works, and I'm going to tell you also why I think it works. You have to understand, if you go to an EFT seminar, you will be paying hundreds of dollars. You will be paying, lakhs in Pakistani rupees in a 1 day seminar to learn EFT. I'm going to teach you in maybe 30 minutes, and then you can go ahead and practice. All right. Why I can teach you in 30 minutes is that once you learned it and you master a thing, then it's easy to decode it, especially if you come from a psychology background like me. For those of you who don't know me, my name is Ibrahim Siawash. I am currently finishing up my PhD in psychology, and I've been teaching since 2016 hypnotherapy, NLP, and DBT skills, and I've been practicing since 2011 after graduation. So let's get into EFT, Emotional Freedom Technique, and what that is. Before you understand EFT, you have to understand the principle of meridians. Okay, meridians is a core principle of traditional Chinese medicine, TCM. All right, I'm also a homeopathy doctor actually, and even though I don't practice homeopathy, but TCM was a complete subject that we had to master when we completed homeopathy. The 12 meridians that exist, what basically they represent is in the ancient Chinese, China, in the ancient China, like in BCs, it was believed that energy flows through the organs in the body through channels, just like train rails, right? That has stations, smaller stations and bigger stations. So smaller stations would be these points that you can see in front of you. So for example, if you take the bladder, let me in fact choose a color. So if you take, for example, the bladder, the dark blue, so the meridian ends, the energy they say is flowing from your bladder. Now this is the back side, so it's the buttock. It is flowing up, and it goes somewhere into the brain, and then in the front the same thing, and then flows into the bladder somewhere. All right. Now, as you can see, there are points here, right? Some points are minor points, as you can see, smaller ones. Some charts, some demonstrations, they show the major points as well. All right, that doesn't matter, major or minor. The idea that the traditional Chinese medicine thought was these energies flow, and any blockage in any meridian causes disease. So, if you have a disease of bladder, any kind of disease, like if it is even if it is an infection, you can you urinate too much or not too little, or any other urinary infections or any other bladder related issues. What it was thought was that the meridian that carries energy back and forth from uh, your bladder to other organs, somewhere there is energy block, right? So the train is not able to travel back and forth to your bladder. That's why you have this disease. That's why you have this uncomfort in your bladder, right? So what was the solution? The solution was in one mean or another triggering these points. All right. The most famous one that you have seen is acupuncture. Acupuncture is where needles are inserted in selective acupuncture points. All right. So acupuncture are inserted in acupuncture points, And while they are inserted, they leave it there for 30 minutes or 40 minutes, depending on different diagnostic criteria. And then when they release these needles, energy flows back again normally. All right. So the block will be unblocked. That used to be the theory of traditional Chinese medicine, TCM. Later, after it went Western. The TCM went Western. It was Westernized. Because of health issues, needles were avoided. So then, the Westerns added what they call acupressure. So instead of pressing needles under the skin and risk getting more infection, just press these points. All right. And they are still a very commonly used techniques. You watch any yoga practice, and even the yogis borrowed this principle from the traditional Chinese medicine. Like, for example, if you can't fall asleep, press the point, hold it for 10 seconds, the point between your thumb and your index finger, hold it for 30 seconds, and then release it so the energy can be released and you can fall asleep easier. And it does work. I'm going to tell you at the end of this video why I think as a hypnotherapist and psychologist, it works. Okay, so this was the principle. If you somehow activate these acupuncture points, the energy will release. Now, emotional freedom technique borrows from the same principle of TCM, traditional Chinese medicine, to deal with emotions that are believed to be stuck. Stuck means recurring emotions, suppressed emotions. So if you often find yourself feeling sad, if you often find yourself feeling tired, if you often feel yourself feeling angry, some organ related to that emotion is having a problem. The energy is blocked there. All right. Uh, so the solution would be to somehow trigger the flow of that energy. All right. Now, obviously, in the modern science, we have better charts, better models of human physiology, human anatomy, and we don't go to the acupuncture chart anymore. We just pick up a chart that is for like a model of nervous system. So it is actually kind of correlated with the nervous system, the traditional Chinese medicine. Okay. So, for example, if there is an acupuncture point here and you bang it against something, suddenly you feel a nerve activated, the big nerve activated in your small two fingers. The same principle, but the difference is here. What's gonna happen is it's gonna be we are not going to puncture those points and not pressure those points, because later on apparently the Western people, they didn't even like pressuring it too much, because the pressure would be, you take a very hard wood and just jam it into the pressure point, right? So that was even too apparently aggressive for the Westerns. So what they did then, they started the movement of tapping, tapping technology. So then what you do is, after identifying what channels are, then you tap them. Tap, 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 tap. Tap them, right? For EFT, we have a specific points that you have to tap. All right. Before I teach you the exact technique and we go and practice, if you have any questions, you can raise your hand. I will let you unmute. Remember that your voice is being recorded and will be shared on YouTube for learning purposes. Any questions? All right. Then let's move on to learn EFT, and then we go into the breakout rooms and practice it. Okay. So you understand the background and you understand how we're going to use it. These are the steps to perform an emotional freedom technique session, EFT session. First, what you want to do is sit and talk with your client and understand an issue problem, like a feeling that has been an issue. Now, the client might say, I feel this emotion too much, or I feel this emotion too little, or I feel this trauma stuck in my certain body part, or whatever, something emotional that you identify. All right. Step number two, what you want to do is have a rating. Now, because these techniques are very vague and not completely scientific, we want to bring a little bit of science into it so that the clients can feel also in their conscious mind that they have progressed through healing, right? And so I ask them to rate it 1 to 10 in intensity, means not just intensity of today, but usually. So not just today, but usually when you feel angry, for example, how intense do you feel it? So if you come to me, for example, you don't want to be angry, I ask you how, when you get angry, usually how intense is your anger? 0 to 10. The client would obviously say 10 or 9. It's a problematic emotion. That's what they're here. Or they say something like, I am sad all the time. Okay, so then I ask them, how sad are you right now? 0 to 10. Or usually, how sad do you get? 0 to 10, something like that. All right, so they rate it. Let's say they rate it a 9. Okay, now I write it with myself so that I have a memory of it. Then we start doing and performing the EFT, the emotional freedom technique. How to do it? We set up a statement. All right. Now, what does that mean? A statement is these words and a blank. Even though I feel dash dash dash, I completely accept myself, I respect myself, and I love myself. Okay. So, since the client in my example that I'm talking to you is angry, so even though I feel angry, um, uh, or any other emotion, I completely accept myself. I respect myself. In fact, one of you is feeling tired, fatigue right now. All right. For example, if you have a chronic disease and you feel fatigue right now, you can use this technique right now as I'm teaching it. So even though I feel tired or fatigued, I completely accept myself, I respect myself, and I love myself. Yeah? All right. Now, if this suggestion, if this statement sounds a lot like ACT, acceptance commitment therapy, it is because it is just that. All right. Then next, you start doing the tapping sequence while loudly or in your mind saying this statement. My advice: say it loudly. For me personally, it works better when I'm doing it loudly. But then I am a very expressive person. So even when I'm stressed, I take a walk. So I am a very dynamic, action oriented person. You do you. If you feel like saying it out loud is more working for you more, do that. If you think saying it in your mind works better, do that. Doesn't matter to me. Or the EFT technique, it's gonna work either way. So tapping sequence, what is that? The tapping sequence is a sequence of activating certain channel in the certain meridian and tapping specific parts to activate that meridian, which the traditional Chinese medicine would say it is for emotions, right? And we're going to learn it in the next slide. Right now, just understand that there will be a tapping sequence, and while you are tapping on your body in this sequence, you have to keep the issue in your mind. The issue being you being tired. All right. If you can visualize it, it's even better. If not, just the idea, have it in your mind. Now keep repeating the sequence, repeating and repeating and repeating, and then checking in with your client. What is the intensity of the emotion now? From 1 to 10. The client says something like 3. Then go continue, tap, 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 and say, even though I feel tired, I completely accept myself, I respect myself, and I love myself. Tap, tap, tap. Keep saying, keep saying, keep saying, keep doing, keep doing. Until at one point, you stop the client and ask, what is the intensity of the emotion now? And they would say like 0 or 1 or 2. If it is more than 2, keep tapping. All right. Now, interestingly, a lot of people express and release a lot of deeply held emotions. All right. People would cry, people would scream, people would mostly cry or take deep breaths, releasing some emotion. You can see them in their physiology changing as they go through this process. All right. So these are the 6 steps, and that's it. If it is less than 2, you just tell the client, good job, thank you for volunteering, thank you for participating, and then move on to whatever you want to talk about next. So what is this tapping sequence? I'm going to teach you this tapping sequence. Again, you will start tapping after identifying the issue, rating the intensity of the issue, setting up the statements, then you start tapping. So tapping where? Point number 1 is the top of the head. Now, where is this top of the head? The top of the head, I hope you guys can see my video also. The top of the head is right in the middle of your scalp, right? If you draw a line from the top of your ears straight, they meet somewhere in the middle. All right, that would be the top of the head. Okay, so what we ask you to do is tap it. Now, when you are tapping, ear, top of the ears, in the center, right here, tap, 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 tap. Okay, this is the tap. Now you can use your fingers like this to create more pressure. I advise to create as much pressure as it is comfortable for you. I don't want you to do the acupressure and then take a stick and then jam it into your brain. No, no. But and I also don't want you to just use it tap soft. No, you know, but something that helps, like your head is shaking, you can feel it inside of your body. All right. So point number 1, top of the head, make sure you are using maybe your whole hand or maybe 2 fingers or 3 fingers, whatever. I want you to make sure that you're feeling it inside of your body. That makes sense? Okay, so the first point is the top of the head point. Tap, 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 tap. Second point is eyebrow point. Now, where is this eyebrow point? The eyebrow point is at the end of your eyebrows. Even if you have a unibrow like me, right? Still, one eyebrow you can clearly see ends here, right? So basically, it's your eye socket. We're gonna tap around your eye socket. This is a very important part. This is where you get all your migraine pain, right? So inside. Then what you can do is you can tap with a single finger or 2 fingers. Once you master, I use these 2 fingers. These are the most powerful ones. So I do tap, 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 tap. All right. So you can use 1 tap, 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 then 2 tap, 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 tap. You get it? The third one would be the side of the eye, as I will show you in the chart right now. All right. So as you can see here, the first one was top of the head, then inside of the eyebrows, right? And then side of the eye. So side of the eye, how? If you close your eyes, wherever is your eyelid, usually is at the center, right? But at the side, the eyes, the socket, your eye socket, you can feel a bone. If you feel around your eyes, there is an eye socket. You can feel the bone. Take that and the middle of your ear, huh? And then somewhere in the between them, like in the middle of this point is an important point. So if you feel the side of your eye, there is this bone, occipital bone.
Yes.
And then your eye, your ear, the hole in your ear, the inner ear, and then somewhere in the middle, find it. That's where you want to tap. Okay? So inside of the eye, side of the eye. Not here, huh? Here. Between the ear and the eye socket. Ta 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 ta.
Below the temple, sir.
That's the temple point, yes. So what we want to activate the temple, right? And then under the eye is right under the right at the center of the bottom part of your eye socket. All
Oh,
right. First we did the inside, then we did the temple point, and then we did the lower eye. Easy?
yes.
Right. Then what we're going to do is the upper lip point. Okay, I'm going to tell you upper lip and chin point together. Upper lip point is basically the gum. It's going to trigger your upper gum. But this is how they teach it in the traditional Chinese medicine. The tip of your nose and your lip in the between. Okay, tip of your nose and the lip between it. So tap, 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 tap.
Yes.
Basically, you are tapping the gum, the upper gum. Tap, 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 tap. All right. Then the chin point. Now, the chin point is also between the bone and lower lip. Bone, lower lip, in the middle, the chin. Like I have a hole here. I can clearly just tap above it. But lower lip, chin, tap between, tap, 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 tap. Right? So far we have seen middle of the head, inside of the eye, temple point, eye point, under eye point, upper lip point, and chin point. All right. Now this is covered. Now this has covered all of your face. Okay. So you tap these while saying, even though I feel tired, I love myself, I accept myself, and I respect myself. You can say it back and forth, no problem. Even though I feel tired, I accept myself, I respect myself, and I love myself. All right. So what is next? Face point covered. Now we go to the collarbone. The collarbone, and then underarm, and then karate chop. I'm going to teach you these three. All right. Collarbone, underarm, karate chop. Now, collarbone is an interesting one. Now, this is your collarbone, okay? From your shoulder connects to another one bone here, shoulder, okay? And here in the middle, you can feel them joining together, all right? So if you take this joint that they are joining together and your shoulder, the bone, follow it, follow the bone, follow the bone, follow the bone, and in the middle, you can tap. Again, it doesn't have to be 100% accurate. So you can just tap on the bone. Find the bone of your shoulder between the center of your collarbone and the shoulder and tap there, right? Now, this is because it's a big area, you need a lot of force. So tap, 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 tap. All right? Tap, tap, tap. Next point. Next point is the nipple point, but because we cannot reach it from the front, we raise our arm and we take from the nipple to the underarm. All right? Underarm, nipple, where they cross, we tap here. All right? It goes under your chest plate. Okay? Supposedly, it goes under your chest plate. So you go tap, tap. This is where the lymph nodes gather. Tap, 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 tap. Now, obviously, other hand needs tapping also. So I raise my other hand. Same. Tap, 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 tap. All right? Last point is the karate chop. Karate chop is a very common point in every traditional Chinese medicine, right? The wrist bone and the first finger's bone, right in the middle, right? So here, this is your karate chop. This is where you break the woods with, yeah, karate chop. So you tap it. Okay, please don't be kind of a person. Sir, am I tapping the point with my karate, or am I your hand will be still and this should be forcing this one? Doesn't matter. All right. So obviously I do one hand, then I do the other hand. Karate chop. All right. Now let's do it all together. All right. Head point, eyebrow point,
Temp.
temple point, under the eye point, upper lip point, lower chin point, shoulder blade points, right? And the underarm, and karate chop. All right. And again, if you miss one like underarm and then karate chop, it's not the exact science. Nothing is gonna ruin your day. Okay. Now, while you're doing, what you're gonna do is you're gonna keep the problem in your mind. I am tired. I am tired. And then you're going to say, even though I feel tired, I accept myself, I respect myself, and I love myself. Even though I feel tired, I accept myself, I respect myself, and I love myself. Even though I feel tired, I accept myself, I respect myself, and I love myself. Please don't ask me how many times, how long I should be tapping. Just go with your heart. Just go with what feels right. All right. So even though I feel tired, I accept myself, I respect myself, and I love myself. Even though I feel tired, I accept myself, I respect myself, and I love myself. Even though I feel tired, I respect myself, I accept myself, and I respect myself. Okay? Keep going, keep going, keep going, keep going in a circle and cycle and cycle, and then take a break. So, how tired am I right now? 3. Continue. Even though I feel tired, I accept myself, I respect myself, and I love myself. Even though I feel tired, I accept myself, I respect myself, and I love myself. Even though I
So
feel
it really works,
tired, I know it works. Okay,
because
yes, go on.
I do it already, and I do with the kids as well. Kids.
I know if you're doing it even with this video, you might have felt the heat coming. Even when I was doing it, it's very cold here. Even though I'm doing
Hmm.
it, I feel the heat coming off my body, right? Okay, so here is why I think it works. Personally, off the record, I don't think it works because, and that's it. First of all, that's it. You already have learned how to do EFT. Congratulations to you. Okay, so this is the complete. You can take a screenshot of this. This is the complete EFT training for you. The points and the statement. You can take a screenshot and take it with you. I'm going to close this and then finish the lecture in. All right. So, okay. So I think how it works is just like now we saw Dr. Huberman getting hypnotized. I think as a hypnotherapist and psychologist, it works because of suggestibility, because of the affirmation that you are saying, the movement, the belief. You know, that's why it works. But even though if you don't know why it works, you don't always have to know why something works. My brain is a little, my screw is a little loose. That's why I go into the why of things. You don't have to know. Your clients doesn't have to know. As long as they get better, they feel better, they release emotions, they release unwanted emotions. There you go. Your therapy is successful. So that's it for EFT. Points, affirmation, go on and go on and go on until it's released, and it does release. All right. For more, of course, to learn more about psychology and other courses, you can always watch any of the links below. Visit our website, pimscourses.com, or you can always reach out to me on any social media, ibrahimsiawash.com also. And WhatsApp number is also under this video. You can always reach out. Good luck to you. Enjoy healing.